Greetings, fellow therapists, fellow healers. My name is Dan Miller, the developer of the Upper Extremity Ranger, and excited to share with you some advancements that we've made in the Ranger itself, as well as an accessory tool, essentially to make you most efficient and to help your patients heal most thoroughly. So beginning with the flexible hand support, it's just what it says. And the reasoning behind that is the undulation of our hands as we reach. The Ranger can now accommodate that for the higher levels. On both the rigid hand support and this flexible, is the bottom now pivots in a fluid joint within the tube. So it's just that much greater dimensions of motion. And then the accessory, a tracking frame, which can be portable. It can be on a door to send home with the patient, or it can be mounted in your clinic wall. And essentially the application is you slide it in and drop it down, and then you can apply a closed chain to open chain depending on your application. So today, for an example to support the narrative, we're going to look at reaching. So essentially a ground up endeavor of movement. And the way I like to do it is to use the ipsilateral lower extremity with reaching because of how it coincides with walking. So at mid stance, we start to progress over the top of that leg, and that just happens to go with the beginning of reaching. So in that manner, I will use this freestanding as an example. And so however you want to facilitate the glute, but oftentimes, especially on the left side, it can be inhibited through postural distortions. But one of the values of working with closed chain is that if you're doing a functional task that the body's used to, so say for example you have a knee patient or a hip patient, you can still think of the task of reaching to facilitate that lower extremity. And so for our shoulder patients, we just don't want to lose that either. So we just use that in that manner, just beginning with that, and you can just see how it just initiates a reach. So what's important is the range from 50 to 70 degrees. It's the most vulnerable for recovery of the mechanics of the shoulder. And so we really want to make sure we have foundation underneath the shoulder, freedom in the torso, so a patient doesn't continue to close and impede their shoulder in that process. So that interval, if you can master that with the applications that I'm going to describe to you, it's going to be a lot easier for you to get the rest of the range and function in multi-planes. But that foundation is critical. So ground up. Second would be protraction of the scapula, which is achieved with the slight supination and forward reach. Facilitates the serratus anterior and long head of the biceps. And then commonly more towards 70 degrees is that upward rotation of the scapula and that rhythm with the humeral head. And so to accomplish that, we do a slight circumduction, and that facilitates the lower trap. So protraction, circumduction, and then you could isolate external, internal rotation. And from that, if you're facilitating external, you could facilitate it and then integrate it into a reach. And so differently than pulleys or finger ladders or rigid bars, you're working on a neuromuscular level, biomechanical level integrated. And then you can be more specific once that's established and then expand it into the rest of the body. So if I'm reaching and I'm looking over here or I'm looking over here, that dynamic is underneath the cervical thoracic junction. And so the patient is much less likely to go into that recruitment of the upper trap. And so the whole body is working more efficiently. I can even isolate portions of the torso if that is restricted and come across the body like this, and just making it as natural as possible per patient's needs. And you as a therapist, it's the third hand for you. So you can be doing manual supportive techniques to just be that much more precise, but with that capacity of the patient being able to communicate with their body right where they need it, that therapeutic threshold. So I thank you for your support of the Ranger, and I hope these progressions make it that much better for you. Thank you so much.